my name is Crystal, and for week 8, we had an ethics corner where the prompt was to discuss the nurse's role after a disaster, natural disaster, civic disturbance, pandemic, etc., and helping rehabilitate the community ethically, like mental health, PTSD, and etc. I did actually find an article that was pretty helpful. It was called Mobilization of a Nursing Community After a Disaster. Um, Basically, the article kind of goes over the steps that were taken by pretty much a disaster like recovery. They were helping recover a community, I think it was Fort Worth, Texas, after Hurricane Katrina. They did actually pinpoint some things that seemed pretty helpful in like helping the community after Katrina. So what they used was American Red Cross volunteers, and they also went through like nursing organizations to help get volunteers that were willing to come in like from out of town to come in and help. They said that they had a pretty good group come in right away, like within 48 hours. They had like over 100 RNs. They had some paramedics, some physician assistants come in to help. They also reached out to, it's called DMHS, it's called Disaster Mental Health Services, to also help with, of course, like the PTSD, the trauma, the psychological trauma that people go through, you know, from losing their homes and feeling like displaced. They said that those were extremely helpful resources as well. So first they had to locate shelters, areas where they could like house all the healthcare professionals. They said it ended up, I think 100 individuals arrived within the first 48 hours, but then after that, I think they had up to like 400. So they did end up finding a place to shelter them. And then from there, they ran into issues with training them. So you do have to train them, specifically find like where you want them for roles and stuff. And I feel like that was pretty good. Like, although the training, they said they only did 6 hours, I feel like ideally they would require more, but at the same time, you know, you want those people out quicker. You know, a lot of these, you know, are actually experienced nurses, so they should be able to, you know, kind of have a good idea if you tell them, like, give them like easy jobs, not trying to overwhelm them. I think it should be okay. With the 6 hour training, really going over more important stuff still, like HIPAA and everything, and what their roles would be during the recovery process. Some interesting things that the article covered. So there was, of course, the stuff they ran into with training, and then also kind of seeing what the resources of the community, what they had, if they had like ready to go kits and stuff for the community. So it definitely did help just trying to see what this community already had to offer. Another thing that they went over, of course, is reuniting families. They ran into another issue where they had to keep getting CPS involved while they were trying to recover families. They were having to kind of get CPS involved because they felt whenever they were reuniting some of the families and they were seeing that they were the guardian, and the kids like kind of looked like those people were unfamiliar to them, so they weren't releasing them so willingly. They needed to have like documentation, and it just kind of was a heavy process to go through. So that was another thing that they kind of ran into. They didn't mention having any documentation. I think that's what I would have done differently. Had some, I mean, it's kind of difficult, especially because, you know, these people lost everything, lost their homes and everything. That's where you would typically find their documentation. But if some of them had them, I mean, it would be a good way. Or some pictures, even just pictures showing that, you know, hey, this is my kid, like, look at all these pictures, you know, prove. Another thing is if they still have their phone, a lot of people do have documentation on their phones now, as well. So if there's some type of way where they can like prove, and it seems pretty solid evidence that that's their children, I think I'd go about it that way, not just kind of going based off how the child feels. Of course, if the kid's like, hey, it's stranger danger, then, of course, then you would for sure get CPS involved. They also had trouble communicating. I could see how that would be an issue, especially while, all these people are flying in, trying to come and volunteer. They're not in a familiar area. They already haven't slept well. It's hard to get sleep during these times. And everyone's exhausted and just not really knowing what's going on. It's kind of really hard to keep things organized. I feel like although there should be like a main person kind of developing everything, that they should kind of split up between like 5 or 6 people who should be the leaders and communicating amongst each other and kind of keeping it to those people, at least have some main people kind of coordinating everything, organizing everything, especially their group of people, making sure that their part's getting done. And then, of course, communicating with the other main leaders on what the issues are, how to resolve them, bring up concerns that the volunteers are having, what they're running into, especially with keeping the volunteers, because you don't want to burn out the volunteers, so making sure that they're getting fed, making sure that they're, they have like appropriate place to shower, of course, the shelter to sleep, just things that they need would be important as well. And then, of course, establishing where to get your supplies from, just seeing what's running lower, having just one individual or a couple, or even the leaders that are in charge of the groups, keeping track of like what supplies they need, seeing if any places can provide donations, things like that. I think that was, of course, it. I know a lot of the PTSD and stuff should really be covered by like the disaster mental health services. I had never heard of it. I feel like that's actually pretty unique that they have that. I feel like that's really where you would kind of try and assess the individuals that you're helping, and then of course, even if they're not showing signs, still offer their services to help them get through the PTSD and everything. See if even if we have any type of like human resources that can help them. I know the government typically rolls out with some assistance for individuals that are affected by natural disasters and things like this. Even with COVID, they did help the community with certain things. So, of course, helping them kind of rebuild and getting them back on their feet. It's just not the immediate like medical side of things. It's also like the emotional, the financial, the support system and everything. We do have to kind of consider it like as a whole, trying to cover every corner to get these people back to hopefully at some point back to normal life. It's a process, but it's definitely at least getting them back on their feet and giving them the resources is probably one of the most important steps. Thank you for listening.